video. This is my video submission for an NGT procedure. The very first thing we're going to do is check the order. I want to check the patient's name using his date of birth as well to identify him. Once I gathered my supplies are going to be a drape to put over the patient to keep him clean, the nasogastric tube itself, some lube for the tube, and some tape and gloves, and maybe a 60 milliliter syringe so I can aspirate for gastric juices. But I'm going to prepare this tape real quick. Alright, so when I enter the room, I'm going to perform hand hygiene, verify the patient's name, date of birth, introduce myself as Nurse Greg, tell him I have an order for an NGT procedure, and if he's okay with it, I'll ask him if he has any allergies, and if not, I probably want to quickly inspect his nares to make sure there's no blockages or anything, and I can ask him if he has a preference on which one to use. When I explain the procedure, I'm going to tell him it's going to be a small tube that's fed through one of his nostrils. It's going to be advanced down to his stomach, and it's used for medication administration and possibly nutrition. So I want to make sure I have the bed raised so it's a comfortable height for me to work with. And he's in the high Fowler's position. So I've hand sanitized. I'm going to don some gloves. And one of the important things when preparing the tube for the patient is when you're taking it out of the packaging, you want to keep it clean because it's going inside of his body. So I'm going to make sure I try not to touch anything with the tube. And the reason for this drape is just for that, so I can keep him clean and the tube probably clean. So put that over him, make sure he's comfortable. Okay. So before we insert the tube, I can get the tip of it, measure from his tip of his nostrils, behind his ear, and down to his xiphoid process. This thing's already marked, but I can mark it right there so I know how far to insert the tube. Once I've done that, I can lube 2 to 4 inches of the tube to help it move through the nasal floor. I'm going to want to ask him to tilt his head back while I advance this across his nasal floor. And I'm going to tell him before I insert it, when it hits his throat, he might feel a little bit of discomfort. I'll pause, and I can offer some water to help it advance down, or he can swallow if he's NPO. If he coughs or has any discomfort in breathing, I'd want to probably discontinue the tube as well. So I'm inserting it slowly down across the nasal floor. And at this point, he can tilt his head forward once it hits his throat. I would pause, ask him to swallow, or if he needs any water, and then he can keep swallowing. I would just slowly advance down until I've seen that it hits my mark. Okay, so once I've hit my mark, I'm going to get my tape. Ask him how he's doing. He's still comfortable. Go ahead and secure it. So I have a small portion of the tape going over the bridge of his nose, and then 2 tails that are wrapped around each side of the tube. That way it stays secure. I can add an additional piece of tape to hold that first one down. To make sure that it's in his stomach, I can send him off to get an x-ray to visualize it, or we can also aspirate for gastric juices. And we can check the pH and make sure they are indeed juices that would be found in the stomach. Again, I would remind him where his call light is. I would bring back the side rails, which I never put down, but I probably should have. And just tell him that if he has any discomfort, problems breathing, coughing, anything like that, then I can recommend a discontinuation of the nasogastric tube. Alright, so when we discontinue the nasogastric tubing, we want to make sure they're first in the high Fowler's position. Secondly, make sure that they're not having any suction or feeding taking place at that time. And we want to make sure that they're holding their breath. Once they've held their breath, we can clamp the tube, gently remove the tape. We're going to just kind of quickly remove the tubing. Okay, with jejunal feeding tubes, we want to make sure to flush with a small amount of normal saline. We're going to remove the wire and make sure we save that and tape it to the head of the patient's bed. For medication administration, first of all, we want to verify the order against the MAR, make sure we have the right patient, dosage, and everything. Once we've done that, we can gather our supplies. We're going to make sure we wash our hands and don gloves, which I've already done. When you're gathering supplies, make sure you grab some towels, drape over the patient so you can keep their linens clean and keep the patient clean as well. When you are preparing nasogastric medication to administer, you always want to check for residual, and you can flush that out. So when you get your tube, you're going to clamp it. And part of the supplies that we've gathered is a 60 milliliter syringe. Remove the plunge, inserts it into this part of the tubing, and then we'll simply flush with 30 milliliters of normal saline. We can unclamp once the 30 milliliters are in the syringe and let it freely flow through to clean it out. Once we can see that all the residual has been cleared, we'll make sure we reclamp. When we get our medication, we can crush it up. When we're Apostle mix it with normal saline, and we can do the same thing and just put it in the syringe, unclamp it to administer the medication. And once we make sure that's been cleared all through the tubing, we can flush with an additional 30 milliliters. We need to clamp first. Before you administer any kind of medication, we just want to also make sure that there's no actual suctioning or feeding being administered at the same time. This is complete. Take everything apart and you're done.